don't know about you all, but this is like my seventh take. Okay. So I interviewed for this activity Benjamin Barnes, who is a certified family nurse practitioner currently employed at Bon Secours Mercy Health West Emergency Department. So obviously, that being said, his area of advanced practice nursing is emergency medicine, which he has been doing since about 2016. So some of the roles and responsibilities that he has as an advanced practice nurse is he's responsible for seeing any and all patients that enter the emergency department, with the exception of ESI level 1 patients, as well as the severely acute trauma patients. However, we typically don't see the latter, as those are normally transported straight to UC. So as an ED-FNP, he said he sees anything from those suffering with mild rhinitis or runny noses to those with triple A's. But with the more acute patients, he does have to staff those with an overseeing MD in the department to ensure the most comprehensive care for the patient affected. Some of his other responsibilities include suturing lacerations, INDs of cysts, shoulder, hip, elbow reductions, vaginal exams, making sure that he's going over all of his ordered laboratory tests and radiology images in order to come to an appropriate diagnosis for his patient affected. That being said, he also needs to make sure that if he is not able to come up with an appropriate diagnosis for his patient, that he consults with the necessary provider to help him do so, i.e. the specialties, neurology, cardiology, gastroenterology, etc. So utilizing biostatistics within his professional practice, he said that in order to stay current on the most effective therapies, medications, and interventions, he has to be able to interpret the most current research studies accurately. So if a study produces results that are not statistically significant, it's most likely not something that he's going to be employing within his everyday practice. However, even when a study is able to produce results that are statistically significant, he also needs to use his clinical discernment skills to decide whether or not the findings would be appropriate within an emergency department setting. So that's something that we both agreed upon, is obviously knowing how to decipher the studies is extremely important, but then an additional layer would be to see if utilizing the results would be acceptable within your specified field of study. So I think that's it. Thanks.